I'm a board-certified physician in gastroenterology and internal medicine at the Digestive Consultants for the St. Luke's Medical Group. I specialize in the prevention, diagnosis, and treatment of digestive tract and liver disorders, including conditions involving the esophagus, small intestine, colon, pancreas, and liver. I provide quality and individualized care to all my patients in a warm and compassionate environment. My philosophy typically centers on active listening and educating my patients. My goal is to provide the patient with accurate information about their condition. I also work on engaging the patient in the treatment options that are available in managing their condition. It's important to me that my patients would know that I'm a good listener, very knowledgeable, and non-intimidating. My patients should always feel that they are in good hands and getting the best GI care. I earned my medical degree from the American University of Beirut and completed my residency in internal medicine and fellowship in gastroenterology and hepatology at St. Louis University School of Medicine. Besides English, I offer services in Arabic and French. I believe that each specialty tends to attract a certain personality type. And during my medical school years, I noticed that the personality type in GI tended to fit mine. As a whole, GI is a great blend of cognitive skills and manual skills. It satisfies all of my interests because I'm able to perform procedures and at the same time take care of my patients. In GI, while you specialize in one organ system, you still feel like you are taking full advantage of all your medical training. So a wide array of problems, mainly abdominal pain, gastroesophageal reflux disease or GERD, colon cancer screening, polyp removal, fecal incontinence problems, GI bleeding, anemia, all kinds of liver conditions from hepatitis to cirrhosis, inflammatory bowel disease like Crohn's or ulcerative colitis, any pancreas or biliary tract diseases, swallowing difficulties, or even irritable bowel syndrome. GERD or gastroesophageal reflux disease occurs when stomach acid frequently flows back to the tube connecting your mouth to your stomach, called the esophagus. When stomach acid comes in contact with the lining of the esophagus, it can cause heartburn and other symptoms. And more than 60 million Americans experience heartburn or GERD symptoms at least once a month. To help treat or prevent GERD, some simple actions can be taken by avoiding spicy, acidic, and tomato-based foods, by limiting your coffee intake, alcohol, or soda, by watching your weight, as being overweight can increase the pressure in the abdominal area, which can aggravate reflux disease, eating moderate amount of food each meal, avoiding bedtime snack, and eat meals at least 3 to 4 hours before lying down. If you're a smoker, definitely stopping smoking will help, and elevating the head of the bed would help too by gravity. And definitely see your doctor if you're taking antacid more than 3 times a week. If left untreated, GERD can develop into serious health problems, including inflammation of the esophagus, called esophagitis, bleeding, Barrett's esophagus, which is a precancerous condition, and definitely it can increase the risk of esophageal cancer. Colorectal cancer is the third most common cancer in the US and the second leading cause of death from cancer. Colorectal cancer affects all racial and ethnic groups and is most often found in people aged 50 and above. 150,000 Americans are diagnosed with colorectal cancer every year, and 30,000 of them die every year, which is more than car accidents. Most of these patients have no particular risk factors, and many have no symptoms. Most colorectal cancers begin as polyps, which are small growths in the lining of the colon and rectum. Removal of those polyps can prevent the development of colorectal cancer. The good news is diagnostic and treatment options have never been better. The most important consideration is to suspect, diagnose, and treat early. Regular physical activity can help protect against this disease, as can eating healthy and nutritious food, avoiding high fat in the diet, as well as avoiding excess alcohol or red meat. Living a good, healthy lifestyle will help protect against colon cancer. Although it requires a bowel preparation and sedation, colonoscopy has many advantages over other methods. Colonoscopy is more sensitive for polyps and colorectal cancer than every other alternatives. Colonoscopy does not just find cancer, it prevents it. Colonoscopy can be less frequent, unlike stool testing, for example, some of which need to be performed every year. Colonoscopy can be performed as infrequently as once every 10 years. Colonoscopy is definitive. In many instances, a positive detection test, such as a stool test, requires a colonoscopy immediately. For more information, please visit stluke's-stl.com.